just sweep the room here to make sure there's no notes at all. There's my patient. Videographer behind me there. There's no notes at all, so we're good. Hello, my name is Monica. I'll be your student nurse today. I'm gonna wash my hands and put on some gloves. Gonna pull the curtain for privacy. Can you tell me your name and date of birth?
Danielle Cooley, 9197.
All right, and do you have any allergies?
Nope.
All right, I'm gonna check your wristband to make sure that's correct, which it is. I'm gonna verify my physician's orders here. It looks like he wants me to do a heart, vascular, and abdomen assessment on you today. Would that be okay?
Yeah, sounds
All right.
good.
So I have my necessary equipment here. I have my stethoscope that I need to give you a listen here, and it has been disinfected. So before I get started, I'm going to ask you 3 health history questions. Do you have a pacemaker?
No.
No. And do you have a history of high blood pressure or stroke?
No.
All right. And do you have any chest pain?
No.
All right. So I'm gonna check your jugular vein distension here. Looking for pulsations in your jugular, which I don't see any, so that's good. I should not be able to see any pulsations. If I did, I would have you lie down at a 45-degree angle and recheck. If I still saw pulsations, I would notify the physician because that is abnormal. I'm going to palpate your carotid here one at a time. All right, and that's good. Both equal bilaterally. Then I'm gonna take my bell side, my stethoscope here, and give a listen. Okay, I'm gonna have you turn your head to the side and hold your breath for me, please. All right, and on the other side, please. All right, so that's good. Nice normal sounds, no abnormal brute sounds at all there, so that's good. I'm gonna check your peripheral pulses. I'm gonna check your temporal, your carotid again, one at a time so you don't get lightheaded or pass out. I'm going to check your brachial and your radial. I could also check your femoral, which are in your groin area, but I'm not going to do that today. I would normally have you pull up your pants or put on a gown or wear shorts or something so I could do this skin to skin while I check your popliteal. I'm going to check that on both sides. Then I'm going to check your posterior tibial and your dorsalis pedis. Okay, good. And those are all equal bilaterally throughout, so that's good. I'm going to change my gloves and wash my hands after touching your feet. And I'm just going to check your skin around your precordium, as well as the rest of your body, and it all looks good. The temperature is nice and warm, normal. I don't see any lesions. I don't see any blue around your lips or your nails or your feet at all, so that's good. That indicates some good circulation, so that's good. Also just palpate here. Do you feel any tenderness when I do that at all? No. All right, I'm checking for any nodules or lumps or masses at all, which I don't see. I'm also checking for pulsations. I should not be able to see or feel any pulsations around your precordium area, except for occasionally on the apex of your heart right there. Checking for edema as well, too, around your heart. I don't see any edema there. It came back within 10 to 15 seconds, so that is good. And I'm going to listen to your 5 heart sounds here. Gonna listen with the diaphragm and the bell side. So I'll start with the bell side since I already have that on here. I'm gonna find your ankle of Louis and then go slightly to the right. Listen to your aortic. And go to the opposite side here. Under your shirt. Listen to your pulmonic. And I'm going to go down again and listen to your Erb's point. I should be able to hear the S1 and S2 heart sound equally and most clearly here. And I'm going to go down and listen to your tricuspid. And then we're going to go down again and listen to the mitral and the apex of your heart. Okay, so that's good. I'm going to listen with the diaphragm side now. Again, find your ankle of Louis. Slightly to the right. Listen to your aortic. And then go to the opposite side and listen to your pulmonic. And then your Erb's point. Should be able to hear again the S1 and S2 heart sound more clearly and equal here, which I do, so that's good. I'm going to go down, listen to your tricuspid. And then even further down and listen to your mitral, the apex of your heart. Okay, so that's good. All normal heart sounds there, no murmurs at all, so that's good. And then I'm going to document my findings there, and we're going to move on to your abdomen. So I'll have you void before we start because I'm going to be pressing on your abdomen a little bit, and that can get uncomfortable if you have to go to the bathroom.
Okay, I already went before I got here.
All right, perfect. And I'm going to ask you 3 questions related to your abdomen as well. So do you have a history of constipation?
Nope.
Alrighty. And do you have any pain in your abdomen?
No.
All right. And do you have any blood in your stools?
No.
Okay, that's good. I'm going to have you lay down here with your knees slightly bent. Perfect. I'm going to just pull your shirt up here. See your skin. I'm going to look at the contour and the color, the size and symmetry of your abdomen. That all looks good, nice and normal. I'm going to have you raise your head. I'm going to check for any bulges or hernias at all. I don't see any. Your abdomen's nice and flat, so that's good. I'm going to palpate your abdomen here. Tell me if you feel any tenderness at all.
Nope.
All right, good. I'm also checking for any masses or nodules or lumps or bumps at all. So that's good. I did not feel any. Also going to listen to all 4 quadrants, listen to your bowel sounds, using the diaphragm on my stethoscope. And give a listen in all 4 quadrants here. All right, and that's good. I didn't hear any abnormal sounds. I heard normal gurgling bowel sounds, which is good, very active. If I didn't hear any, that would indicate constipation or bowel obstruction or maybe any masses in there, which I did not hear, so that's good. While I'm palpating, I'm also going to go about 2 centimeters in. No abnormal findings there. I'm also gonna give a listen to your vascular sounds down here in your stomach as well. I'm gonna use the bell side of my stethoscope. I'm gonna start at the top here and listen to your aortic. And then your renal on both sides here. And then your iliac on the other side as well here for your iliac. And that's good. I didn't hear any abnormal sounds there. No brute sounds, just normal swirling sounds, so that's good. I'm also gonna percuss your abdomen here in all 4 quadrants. All right, again, checking for maybe any bowel obstructions or masses at all. I didn't hear any abnormal sounds. It was a nice hollow, dull sound, which is normal, so that's good. All right, so that's good. I'm going to document my findings per facility policy and update the physician as needed. Is there anything else I can do for you while I'm in here and I have the time?
No, thank you.
All right, thank you. Have a good day.